So, were you a good student throughout? Were you trying to manage videos slash books or anything that you were studying on the go? Or were you like कि exam आएगा तब पढ़ेंगे?
Yeah, matlab, in first year though we did not get any time to study, and in starting of second year only also there was difficult to study. But
Yeah.
after matlab, towards the end of second year and in the third year, matlab, I used to watch the videos from there, and also we used to read the standard textbooks like Osborne and Webb.
Very nice. So, you were using Conceptual while you were, doing your duties and you were trying to manage to watch one or two
Yes,
videos on a daily basis. Was that the plan?
yes, ma'am. That was plan. Matlab, it was not always successful, but on an average, I used to watch one video or so per day.
Great. So tell me about your, NEET SS preparation. Was there a dedicated effort, or you felt like whatever you had prepared for your MD exams?
I had prepared from e-conceptual and from standard textbooks during my MD examinations, and NEET was, I think, 1.5 to 2 months after the MD examination. So I think that residual knowledge was good enough to get some good marks.
Yeah, very nice. So tell me about the exam, so those of, the juniors who are watching and want to know, because here, unlike NEET PG, etc., we don't have recalls or, any basis or a reference point as to how the questions come, nor do we practice MCQs anymore in residency. So how should a student prepare? Do you think dedicated MCQ practice is needed, or what you prepare for your MD exams is gonna be enough to solve questions?
I think, ma'am, what we prepare for MD exams, it is good, and if we can just revise it in 1 month before the exam, that should be good enough for this. I don't think that that much MCQ practice is required in this
Mhm.
exam. Usually, what we report, the questions were clinical and mainly focused on diagnosis of the problem, and many of the questions were from intervention also, like how would you manage this case of intervention. So.
Right.
Uh, if we do matlab, good reading for our MD examinations, that should be enough for this exam.